Goodbye swelling. 8 potassium-rich foods you must eat to drain fluid fast. Vertical bar senior health tips. Swelling, often referred to as edema, is one of the most common health concerns among seniors. It occurs when excess fluid builds up in the body's tissues, particularly in the feet, ankles, legs, and sometimes even the hands or abdomen. While swelling can be linked to many factors such as heart health, kidney function, medications, or prolonged sitting, one often overlooked cause is an imbalance of electrolytes, especially sodium and potassium. The modern diet tends to be overloaded with sodium, hidden in processed foods, canned meals, breads, and snacks, while falling short on potassium. This imbalance encourages the body to hold onto water, resulting in bloating, puffiness, and discomfort. Potassium, on the other hand, acts like a natural fluid regulator. It helps the kidneys flush out excess sodium through urine, reduces water retention, and eases the burden on the heart and blood vessels. For seniors, maintaining healthy potassium intake is crucial not only for controlling swelling, but also for supporting muscle strength, nerve health, and stable blood pressure. Fortunately, nature offers many potassium-rich foods that can be added to daily meals to reduce fluid buildup and restore balance. Here are 8 potassium-rich foods seniors should include regularly to help drain fluid fast and say goodbye to swelling. 1. Bananas, the classic potassium powerhouse. Bananas are one of the most well-known sources of potassium, and for good reason. A medium-sized banana contains about 400–450 milligrams of potassium, making it a convenient and affordable choice for seniors. Beyond their potassium content, bananas are easy to digest, soft in texture, and versatile in meals. The natural sweetness of bananas makes them an ideal snack or breakfast option. They can be eaten as is, sliced over oatmeal, blended into smoothies, or mashed onto whole grain toast. Because bananas are rich in fiber, they also promote healthy digestion, which is another key factor in reducing bloating and discomfort caused by fluid retention. For seniors managing high blood pressure or mild swelling in the ankles, incorporating 1 banana a day can gently nudge the body's fluid balance in the right direction without relying on heavily processed snacks. 2. Sweet potatoes, more than just comfort food. Sweet potatoes are a nutritional gem for older adults, especially when it comes to potassium intake. 1 medium sweet potato contains around 540 milligrams of potassium, making it even richer in this mineral than bananas. In addition to potassium, sweet potatoes provide beta-carotene, vitamin C, and dietary fiber, supporting heart health and immune function. Unlike regular potatoes, they have a slightly lower glycemic index, which makes them friendlier for seniors who need to manage blood sugar levels. Roasted, baked, or mashed, sweet potatoes are both delicious and satisfying. They can serve as a healthy side dish, or even the star of a meal when topped with steamed vegetables and a drizzle of olive oil. Their potassium content helps pull excess sodium out of the body, effectively reducing puffiness in the legs and feet. 3. Spinach, the leafy green that flushes out fluid. Dark leafy greens are among the healthiest foods for seniors, and spinach stands out as a potassium-rich choice. Just 1 cup of cooked spinach provides more than 800 milligrams of potassium, nearly 1/4 of the daily recommended intake. Spinach also contains magnesium and iron, which work together with potassium to support circulation and oxygen delivery throughout the body. Improved circulation means less pooling of fluid in the extremities, reducing the heaviness and stiffness many seniors feel in swollen legs. Spinach can be added to soups, stir-fries, omelets, or blended into smoothies. Its mild taste makes it a versatile ingredient. Regular consumption of spinach not only helps with fluid drainage, but also supports bone strength, eye health, and energy levels, areas of concern as the body ages. 4. Avocados, creamy and nutrient-dense. Avocados are often called a superfood for good reason. A single avocado provides nearly 975 milligrams of potassium, which is more than twice the amount found in a banana. For seniors dealing with swelling, this makes avocados one of the most effective natural foods to help flush out excess fluid. Beyond potassium, avocados are packed with heart-healthy monounsaturated fats, vitamin E, and fiber. These nutrients support cardiovascular health, reduce inflammation, and promote steady digestion. For seniors with joint stiffness or swelling in the ankles, the anti-inflammatory properties of avocados provide an added benefit. Avocados can be sliced onto sandwiches, mashed into guacamole, or blended into smoothies for a creamy texture. They also make an excellent topping for salads, giving meals a nutrient boost while helping balance fluid levels naturally. 5. Beans and lentils, the plant-based potassium boost. Beans and lentils are excellent sources of plant-based protein, but they are also surprisingly rich in potassium. A single cup of cooked lentils contains around 730 milligrams of potassium, while kidney beans, white beans, and black beans all deliver between 600 to 900 milligrams per serving. For seniors, beans and lentils provide a double advantage. They help regulate sodium levels through their potassium content, and their high fiber supports digestive health, preventing constipation and bloating that can worsen fluid retention. These foods can be incorporated into soups, stews, salads, or casseroles. For those looking to reduce reliance on red meat, beans and lentils make a hearty, satisfying alternative while also promoting healthy weight management, a critical factor in reducing strain on swollen legs and joints. 6. Yogurt, a cooling, potassium-rich option. Dairy products may not always be the first foods that come to mind when thinking of potassium, but yogurt is a surprisingly rich source. 1 cup of plain, unsweetened yogurt contains nearly 550 milligrams of potassium. Yogurt is also an excellent source of calcium, probiotics, and protein, all of which support bone health, gut health, and muscle strength. For seniors struggling with water retention, the potassium in yogurt encourages the kidneys to release excess sodium, reducing bloating and puffiness. Low-fat or Greek yogurt options are especially beneficial, as they provide more protein per serving. Yogurt can be eaten with fruit, nuts, or blended into smoothies, making it a versatile and refreshing addition to a senior-friendly diet. 7. Oranges and citrus fruits, refreshing potassium and vitamin C. Oranges, grapefruits, and other citrus fruits are not only refreshing but also provide a strong dose of potassium. A medium orange contains around 240 milligrams, while a glass of freshly squeezed orange juice offers nearly 500 milligrams. These fruits are especially helpful for seniors because they combine potassium with vitamin C and antioxidants. Vitamin C supports vascular health, helping veins stay flexible and reducing the risk of poor circulation that can worsen edema. The natural hydration from citrus fruits also assists in flushing excess sodium and balancing fluid levels. Citrus fruits can be enjoyed as whole fruit, juice, or added to salads. Including them in the daily diet offers a sweet and tangy way to reduce swelling while strengthening the immune system. 8. Tomatoes, juicy and potassium-packed. Tomatoes are a versatile food loaded with potassium. A single cup of tomato juice contains over 550 milligrams of potassium, while fresh tomatoes provide around 290 milligrams per medium fruit. Tomatoes are also rich in lycopene, a powerful antioxidant known for supporting heart health and reducing inflammation. For seniors experiencing swelling in the legs, the combination of potassium and antioxidants makes tomatoes especially beneficial. Tomatoes can be eaten fresh in salads, cooked into sauces, or blended into soups. Low-sodium tomato juice is another excellent way to enjoy the benefits while avoiding added salt that can worsen water retention. How potassium helps seniors reduce swelling. Each of these foods works by addressing one of the main culprits of swelling: excess sodium. When the body holds onto sodium, it naturally retains water, leading to puffiness in the extremities. Potassium helps restore balance by encouraging the kidneys to excrete sodium through urine, which reduces fluid buildup. In addition to draining fluid, potassium supports the following health benefits. Lower blood pressure reduces the strain on arteries and the heart. Stronger muscles helps prevent weakness and cramps, which often accompany swelling. Better circulation reduces pooling of blood and fluid in the legs. Heart protection supports a steady heartbeat and reduces the risk of cardiovascular complications. For seniors who may already face challenges with circulation, mobility, or medications that affect electrolyte balance, potassium-rich foods are a natural way to maintain better fluid regulation. Important considerations for seniors. While potassium is essential, seniors should be cautious about overconsumption, particularly those with kidney disease or individuals taking medications such as ACE inhibitors, diuretics, or beta blockers. These can alter the way the body processes potassium, and too much can lead to hyperkalemia, dangerously high potassium levels. Before making major dietary changes, it is advisable for seniors to discuss potassium intake with a healthcare provider, especially if they are on medications or managing chronic conditions. Practical tips for adding potassium-rich foods to daily life. Balance meals. Pair potassium-rich foods with lean proteins and whole grains. Snack Smart. Replace processed salty snacks with bananas, oranges, or yogurt. Cook. Creatively use sweet potatoes or spinach in soups, casseroles, or stir-fries. Stay hydrated. Water helps flush out sodium alongside potassium intake. Monitor sodium intake. Reducing processed foods ensures potassium works more effectively. Final thoughts. Swelling and fluid retention do not have to be accepted as a normal part of aging. By adjusting the diet to include potassium-rich foods, seniors can take a proactive step toward reducing discomfort, improving circulation, and supporting overall heart and kidney health. Bananas, sweet potatoes, spinach, avocados, beans and lentils, yogurt, citrus fruits, and tomatoes all offer a natural and effective way to balance electrolytes and drain excess fluid. With consistent intake, these foods help restore comfort, reduce swelling, and improve quality of life, allowing seniors to stay active, strong, and vibrant. By embracing the power of potassium, it becomes possible to say goodbye to swelling and hello to better health.